Do you feel like crap? Do you feel like you have just been walking around for long periods, whether that be months or years, just not feeling like your full self? There are so many people that I treat, especially women, who have this same issue. And feeling like crap can show up in a variety of ways for them. It can be issues with sleeping, lots of issues with energy levels, fatigue, exhaustion, difficulty losing weight, especially with fat around the midsection, issues with libido, mood issues like stress or anxiety or depression, and they all seem to feed into each other and make each other worse or have occurred starting at the same time, that they must all be related. And the ladies that I treat walk around feeling like this for so long that they feel like there must be something wrong with me. I just have to figure out what it is. So today we're going to be talking about what the difference is between disease, meaning there is one organ that is not working or not functioning appropriately, versus dysfunction, which I think the majority of patients fall into, in that, yes, in the proper circumstances, everything is working together. There has been a breakdown along the way across multiple systems, resulting in everything being off. So if you feel like crap and it's been going on forever and nobody can figure out what's going on, stick around to learn more about the difference between disease versus dysfunction. So I would say in my professional medical career, approximately 10 to 25% of people presenting with this slew of symptoms that I've mentioned have a medical diagnosis or a medical disease. And those come in a variety of things. They could be thyroid disorders, whether hyper or hypothyroidism. It could be PCOS or polycystic ovarian syndrome, premature ovarian failure, which means premature menopause, variations of autoimmune disorders, gut disorders like inflammatory bowel disease, such as ulcerative colitis, or Crohn's disease versus IBS, irritable bowel syndrome, all the way to prediabetes, diabetes, things like that. So again, that's 10 to 25% of the cases have an actual underlying diagnosis of one thing that is wrong, meaning one organ or one organ system is not functioning appropriately. And the correction or the fix for that is usually modern medicine. So that comes in the form of a pill or a therapy or a surgery, something like that. Even though that is a small percentage of the cases, it is very important that if you are having this slew of symptoms that you do talk to your doctor about it and make sure that you're getting these things evaluated for and ruled out. Because if we start treating you in the other category, which is dysfunction, which we'll talk about here in a second, but you still have an underlying disease process occurring that's not being treated, the other treatments won't work. So it is important to get these evaluated and ruled out, especially if you have a family history, especially if you have a prior history of a related condition. Any of those, it's very important to get ruled out. But if you have that workup and you get the answer, everything looks good, I don't know what's going on, then keep listening, because you probably fall into the far larger category of dysfunction. So let's say you fall into that larger category, which is 75 to 90% of the patients, especially women that I see, fall into this category of dysfunction. So I have actually created my own definition of dysfunction for you so that you can understand what that is. So dysfunction is the imbalance of one or more of the body's systems that negatively affect other body systems, leading to a range of symptoms of varying severity. With a dysfunction, it's simply something is out of whack, it's out of balance. It's not necessarily that there has been a full breakdown or that something is broken. It's just not functioning properly. And it usually has to do with systems, body systems, that affect so many other pieces of your body. So for instance, your endocrine system, your nervous system, your gastrointestinal system, your immune system, your psychological system, your metabolic system, and frequently your dermatologic system. And I would say, in theory, every body system could be affected, including your cardiovascular system, your genitourinary system. Everything could be affected, but those other ones that I mentioned are usually the ones that are starting to be out of balance, and then you start to see symptoms in those other systems. Additionally, it can be very hard to delineate or tell what the initial system was that got everything out of balance, unless there's a very good timeline of, well, I got a GI infection and then I got antibiotics and then I started having all of these issues. Then we could probably go back and say, oh, maybe it was your GI system that really kind of set you up for all of these issues. A lot of the times it's a very muddy picture, and it's hard to tell exactly what the culprit system was, and kind of chicken and the egg scenario. That's okay. You don't need to worry about what was the original one that got off. What's more important is that you need to understand that they're all related and that we need to treat all of them, which can sound overwhelming, but just pick one thing and start working with that first. So when I am meeting with patients one-on-one, there's two ways that I approach this dysfunction. One of the options would be to go for the low-hanging fruit. So if there is an easy tweak that you can make in your life that would improve all of these other things, then we'll go for that first. So say you could be an excellent sleeper and you're just not prioritizing your sleep hygiene. You're not making sure you go to bed on time and that you're waking up at the same time. Your sleep environment is all off. If we could maximize your sleep to get high quality sleep, we could lower your inflammation. We could reset your adrenal axis. It would also help further regulate your endocrine system, again, setting you up on that correct 24-hour circadian rhythm. So that would be a good low-hanging fruit that we could intervene on. The other option would be to target the biggest symptoms. So for instance, if your gut was giving you tons of issues, and also we think that it's leading to other issues or associated with other issues like stress, and you're getting skin rashes and changes, and we're starting to see signs of insulin resistance, and you're struggling to lose weight, all of those things, but gut keeps standing out as you're having a ton of bloating every day, either constipation or diarrhea, that would be kind of the heavy hitter that we would want to make sure that we heal your gut first, and then kind of see, did your rashes go away? Did your insulin resistance improve? And then intervene from there. So those are two options: either pick the low-hanging fruit or pick the symptom that is most bothersome to treat and start there. So if you're struggling with dysfunction, I just wanted to go over some of the top things that I think about when I'm working one-on-one with patients. Diet, movement or exercise, sleep and sleep practices, stress management, mind-body techniques is a big one that I go to, and biofeedback. Mind management and thought work is also a huge one that I focus frequently on with patients. Social connection and sense of support is another huge one that I feel like a lot of people are missing out on today, since we are so only connected by the internet, meaning that we're disconnected in a physical sense. So that's a big one that a lot of people struggle with. I'll introduce supplements occasionally when it is appropriate. And then also another place that I find a lot of patients struggling is this idea of sense of purpose. Like, what is your purpose in life, and how are you expressing your purpose and your fullest potential? A lot of people, especially women, I feel like get to this part of their lives where they've worked so hard on their career and they've worked so hard on their family. And then they get into the spot of, okay, well, I achieved all of that. What in the world do I do from here? And have lost this sense of guiding direction. And I feel that that is detrimentally affecting their overall health and some of these systems. So just making sure that you have a clear sense of, like, okay, what am I doing and trying to work on that and figure it out. All right, guys, I've got lots of good resources for you if you're struggling in any of these areas. Make sure to head over to selfhealingdrashley.com. If you're struggling with stress, download my free guide on 5 ways to lower cortisol in minutes. It's an excellent guide. All of these techniques you can use on the go to instantly lower those stress levels and cortisol levels and get the benefits of that. If you do it regularly, you're going to start to see positives long-term on this overall dysfunction. I also have other courses for you if you're struggling with sleep or weight loss, so make sure to check those out as well. Until next time, we'll see you.